Good day, everyone, and welcome to a very special presentation from KUAM and the Guam chapter of the American Cancer Society. It's the very first virtual Relay for Life.
Right, there's just no way we were going to allow COVID cancel this year's Relay for Life. For me personally, my grandmother passed away from cancer, so did my uncle, and my dad is a survivor of cancer.
All right, and we can't gather at the GW track, so of course what we have for you is an awesome night full of inspiration, entertainment, and hope, because you know what? Nothing is going to stop us from celebrating our cancer survivors and honoring our heroes.
That's right, and we start things off with Jason Solis, who sits down with and Zooms with the chair of the event, Joe Rios.
All right, thanks so much. This is one of our island's most cherished events, something that the entire community looks forward to participating in every single year as a family, as a group, as a team. And I have the great honor of being joined by the chairman of the Relay for Life mission, quest, purpose, Joe Rios, my very good friend. So Joe Hoffaday, and it's once again an incredible honor to be able to participate in Relay for Life and continue the fight against cancer in our community along with you and your colleagues. So thanks for being here.
All right, thanks, Jason. Hope you and your family are doing well.
Thank you, same to you.
Survivors, caregivers, relayers, Hoffaday Guam. You know, this is definitely an unprecedented time. And in March, we were forced to postpone our Relay for Life event that was originally scheduled for May 15th. And we had to do that for the safety of our survivors, our cancer patients, and our relayers. So the planning committee had to re-engineer how we can bring back Relay. You know, Relay for Life has been around in Guam for over 30 years. And, you know, it's something that we're so passionate about. The relayers are determined and courageous. We are a community, a family that is that meets all together to take up this fight. I think today, through this virtual relay event here on KUAM, that Guam is showing that even COVID-19 cannot stop Relay for Life of Guam. So give yourself a big round of applause, because you guys are terrific and you have done so much to help cancer patients and survivors over the years, as they really need your help now more than ever. Cancer patients today and survivors are more vulnerable to the COVID-19 virus. So right now they need us, and your American Cancer Society is here to do so. We are here 24/7 to provide support, whether it be through the Guam office or cancer.org, or the toll-free number at 1-800-227-2345. So American Cancer will be here for the cancer patients, for your support. Now, this pandemic has created some tough times for your American Cancer Society, but we will prevail through this. Our mission is too important to fail. So we will prevail. Hope will prevail. But we need you more than ever. I cannot thank you enough for continuing to stand with us in the fight. We stand in the fight against cancer even when we are apart. I want to take this opportunity to thank the planning committee members, volunteers, relayers, our sponsor, and especially KUAM for making this virtual relay event a reality. Now, I want to say thank you. I want to extend my Dunkalun Nasatuus Maasi for continuing to stand with us at American Cancer. Cancer doesn't stop, neither do we. Viva Relay for Life of Guam. Viva Guam.
Biba, I love that, Joe. Thank you. Thank you so much for your inspiring words. I'm sure there are many people watching this right now all over the world that say, you know, I'm proud to be from Guam. I live the Hoffaday spirit. Inafa Malik is part of who I am. So for people that, you know, are still being very, very cautious, and we're practicing social distancing, but still want to be able to contribute monetarily, and they want to make a donation, how can they do so? Because you mentioned some of the numbers about American Cancer Society, but for the people that want to make a donation during tonight's broadcast, how can they do so?
Yeah, you know, you can do so conveniently from your home. You can go to our website, which is relayforlifeofguam.org/GuamGU. You can contribute there. That's where each of the teams are located with their website. Or you can go to the office. The office is open, but it is by appointment for those who feel okay to go. But definitely online is a way for you to donate to American Cancer Society.
Mhm. And as I said, Joe, this is an island institution, the Relay for Life. And even though a lot of people are probably thinking, man, I would love to go out with, my family, my friends, my church group, my classmates and everything, and walk the laps all night and, have the physical demonstration of how much I want to battle against this. We do have something coming up for you guys. So, don't don't be dejected, because we have a way that we all can participate and all walk in the Relay for Life this time. So Joe, I'm looking forward to seeing you on the virtual track, as it were, and we're all going to do the virtual lap together. So that's coming up.
Yeah. All right. I'm excited to do so too.
All right, and Mr. Chairman, we thank you for your tireless commitment to this very worthwhile cause, and for all of the very fine work that you and your colleagues have done. Let's have a wonderful Relay for Life 2020.
All right. Viva Relay.
Biba, thank you, Joe. All right, back to you guys.
Thank you, Jason and Joe. Like Joe said, cancer doesn't stop, and neither do we. So are you guys ready?
I'm ready, and I'm excited. We're going to kick this off with our first round of the parade of teams. We're also going to be having entertainment from local musician CJ Blossom. We're also going to hear from some of the leaders in the fight against cancer. That's former Supreme Court of Guam Chief Justice B.J. Cruz and Dr. Annette David.
But before we get to all of that, let's get to this right now. We go to Governor Lulian Guerrero for her opening remarks.
Half a day. The impact of COVID-19 goes beyond the virus itself. This pandemic has affected our daily lives, and we have had to think of new and creative ways to hold annual events like Relay for Life. As you know, cancer patients are some of the most vulnerable to COVID-19. This virtual event allows all of us, cancer patients, survivors, caregivers, and supporters, to safely come together to celebrate, remember, and fight back. COVID-19 has changed our behavior for the better. We have become more cognizant of our personal hygiene. We wash our hands or use hand sanitizers more frequently. We wear face masks and are mindful of other people. And I don't think these habits will cease once this pandemic is over. But we also must take the same amount of care for other aspects of our health. Cancer will not wait for COVID to go away. Early detection of cancer through screening can drastically reduce the disease's mortality rate. My message today is, if you have not done your annual screening, please schedule it. My worry is not that our medical facilities won't be safe for patients. My worry is that our patients will not think it is safe and delay the care that they need. We are already seeing this happen across the United States. Based on available clinical data and records, more than 80,000 diagnoses of breast, lung, cervical, colorectal, and prostate cancer may be missed or delayed because of disruptions to healthcare caused by COVID-19. This roughly translates to 36,000 missed or delayed diagnoses of breast cancer, 450 missed cases of lung cancer, 2,500 cases of cervical cancer, close to 19,000 cases of colorectal cancer, and almost 23,000 cases of prostate cancer. The same data also shows that screening and monitoring tests for these cancers were down 90% in some jurisdictions in early April when compared to February. As a nurse, I know how important timeliness of care is. Each day a diagnosis is delayed can be a matter of life or death. COVID has taken a lot from us, but we cannot let it prevent us from doing what we can to protect ourselves, not only for us, but for our families. Relay for Life has always been about the remembrance of those who have passed, but also the celebration of life. While the effects of COVID-19 will remain with us for a while, I know this virus will not impact our resolve in our fight against cancer.
Half a day, everyone. We are 76 Circle K. 76 Circle K has been involved in Relay for Life for the last 20 years. We felt that as a community partner, Relay for Life has become part of our culture. We also want to honor those who have been stricken by this deadly disease. Our biggest success has been raising money throughout our chain of convenience stores. Obviously, our customer service representatives put their heart into it by raising money any which way they can, and the customers see that.
All the employees and their families are proud to be a part of Paddles Against Cancer, Ride for Life, Celebrity Waiter, and all of the car washes and other events at the convenience stores. They are all in support and honor Bob Keppen and Herb Tom for being survivors of Team 76. Our fundraising events has been recognized by Relay for Life to be ranked as the top 10 fundraising teams throughout the United States.
Viva Team 76!
Team Fuerza Familia.
H. We hope to help heal the pain.
O. We hope to overcome the suffering. P. We hope to prosper one day for all those fighting. E. We hope to eliminate this deadly disease once and for all. As we unite against this fight, we give hope a chance to heal, overcome, prosper, and eliminate suffering of this disease.
Half a day, Guam. The Guam Harmony Lions Club is proud to be a sponsor of the ACS Relay for Life. We love Guam. Roar!
Half a day. I'm CJ Blas, and this song is my original called Get On Up. Hope you guys enjoy. Now I know what you're thinking, just another love song. Same old story written on a different chord progression. And I know that you're worried about someone else, but believe me, baby girl, you just got to take care of yourself. So why don't you come down? Tell me what it's all about. They left you with an aching head and an open spot up on your bed. So let's not waste more time. Jump up and just start and whine. So now's the time to break through, let it show. And if you're looking for something new, baby, then get on up. You got to get on up. And if you're looking for something to do, baby, then get on up. You got to get on up. All life lessons are learned in time. No, 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 no. So why not pick yourself up, let yourself feel fine. I'm a believer in logic, so if it's true, then baby girl, just let me know. Oh, why won't you come now? I'll show you what this love's about. I understand you're not alone. You've got someone else they call your own. Don't let them waste your time. Don't let them cause the tears you cry. Oh, let me prove myself. You know. And if you're looking for something new, baby, then get on up. You got to get on up. And if you're looking for something to do, baby, then get on up. got to get on up. I wish you were here with me. Me, my zone, no queen. Be living in a dream. Oh, we can make you work. You be so happy. I'd be on your team. Give you everything you need. Oh, you got me saying my, you sure look good tonight. Ooh, you got me saying my, you sure look good tonight. And you're so damn fine. Jesus Marcy, and thank you for supporting the Relay for Life and helping the American Cancer Society save lives.
Okay, the conversation continues, and I have the very dubious distinction of being joined by two extreme talented leaders in our community, Dr. Annette David. Dr. Hafade.
Good morning.
Good morning, and a wonderful relay to you. And of course, let's see, former Chief Justice of our Supreme Court, former Speaker of the Legislature, and now Guam's Public Auditor, the Honorable B.J. Cruz. Hafade.
Good morning. Hafade.
And thank both of you for joining me, because we are talking now about the topic of control of cancer in our community. And I would always like to think that always goes back to leadership. And, you know, for people that would like to take a strong role in being able to make sure that the community understands the nature of cancer and how we can move forward and manage that and be able to issue, you know, marshal the message and communicate. Dr. David, you can probably speak to this way better than I can. So your thoughts.
Leadership is just so fundamental for cancer control. Cancer for me is very personal, you know. I come from a cancer family. And as a physician, I thought at one point I was going to pursue special training in hematology oncology, because I had patients who had cancer and they really affected me a lot. But then, you know, I quickly realized that the clinical care is important, but it's a little bit too late. When you get patients with cancer, you can only do so much at that point. And so it really dawned on me gradually that the key was to intervene upstream before cancer happened. And so cancer prevention became very, very important to me, because so many members of my family have died or have fought cancer. And I decided that what I should focus on was really trying to create change to prevent cancer through policy. But that requires working with community, and it really requires working with community leaders and political leaders. And so for a long time while he was in the Senate, Speaker BJ was our champion. And that was very, very important and impactful to the changes that we made in the policy landscape, which I think have contributed to reducing cancer incidence and prevalence here in Guam.
And I think it's also interesting with your role as a physician, you not only have to you know, understand the nature of the disease, but you also have to have a strong sense of empathy and
That's
understanding
right.
of the patient themselves. And that can be a very difficult thing to do.
It really is. And I remember as an intern, when I lost one of my cancer patients, it was devastating to me. And I think that kind of started this insight that, you know, we can give so much to the care of patients with cancer, but if we catch them at that late stage, there's not really much that we can do. And the big changes can happen upstream with policy change.
Okay, and BG, I would say the same for you, because you are someone who's been no stranger throughout your distinguished career as far as making tough decisions, but also in understanding people and, you know, and when working with the actual individual who is affected by what can be very difficult things.
Yes, and though later in my life, cancer has become a reality in my family and personally, I've been involved with the American Cancer Society since about the time that you were born. I was a member of the American. Yeah, I was a member of the American Cancer Society board in the late 70s, and chaired the American Cancer Society in the early 80s. And it was during that period that after a couple of years working with a really great nurse, and her name was, now I'm going to forget, Jean Kerr. She was the nurse and a member of the board at the time. And she and I used to, whenever she would get notification that somebody on Guam passed from cancer, we had a map of Guam on the wall, and we would put push pins in the map, and we would show where the clusters were and how it was spread throughout the island. And so when I became chairman in the early 80s, one of the first things that I wanted to do was do what Dr. David was talking about, and that was education and prevention. And so that's when we joined and got certification from Hawaii to come on board. And then they provided education, because like everything, I mean, even this whole Black Lives Matter and racism and everything, a lot of it has to do with early prevention. You have to do the preventative work early, have, early childcare, early schooling for children, and sharing everything. But as far as cancer is concerned, leadership was trying to get the education out here, and so that was a big move in the 80s. And I thank Jean Kerr for her educating me about the need to do that, and helping me move the American Cancer Society Guam unit in that direction. And then in the last 15 years, Dr. David and I have joined up forces and worked together on various projects to further the cause of prevention of cancer, with her educating me on the need to get certain pieces of legislation through to be able to fight this dread disease.
Now, I was going to say, can we talk about that? Because obviously in the life cycle of leadership, you've got an awareness and understanding of the problem as it is, and then you have, the communication and, getting others in your way of thinking on board. And now you actually start to put together an action plan. So, Doctor, how would you say you actually carry that over to like say what BJ was talking about now to public policy?
Well, I think to frame it, we need to see cancer not just as a disease, but as an issue of social equity. It really has a lot to do with social and commercial determinants of health. And so, there is a life cycle of advocacy and education, but ultimately it's got to be education with a very concrete action in mind. So, in leadership, they say begin with the end in mind. And what we really sought to do with Senator BJ, with Kathy Castro, with the other members of the NCD consortium, with the American Cancer Society, was to create a change in our policy environment so that we could create a physical and social environment that was promoting health rather than disease. So a lot of the targets were the risk factors for cancer, predominantly tobacco and alcohol, but also looking at nutrition and physical inactivity. And I think that's the key, is that it is a process. You have to be very clear about your vision, and you have to be strategic about how you achieve the vision, because, right, Speaker BJ, it wasn't easy. I mean, every step of the way you have hurdles and obstacles that you have to overcome. And so the partnerships are important, and the strategy is very critical.
Now, how, I guess my final question would be, as we wrap up, there's going to be a lot of young people who are watching this right now and saying, this is wonderful, I'm very inspired, and I'm very uplifted by what they're saying. However, I'm just a kid, but cancer has touched my family, my classmates, people I go to church with, and I don't use the word, hate very often, but I hate cancer. I don't like what it's doing to our community. I've got the passion, I want to lead, but unlike Dr. DeVitt, I did not go to medical school. Unlike, BJ Cruz, I did not go to law school. What can I do in my capacity so that I can lead my peers and hopefully bring about change?
Well, as far from my point, it's what Dr. DeVitt was talking about, is the non-communicable diseases, to recognize cancer as a non-communicable disease. It's not something that can spread like coronavirus. It's something that within your life cycle, within yourself, have to address. And you can control certain things. And the young people at this time can just remember, please, no smoking. For as much as we talked about washing hands now, no smoking should be the same thing. Absolutely no smoking, because the addiction is virtually impossible to overcome, and to exercise, and just try to stay healthy, to lead a healthy life, and to learn from the doctors and the advocates at non-communicable disease, NCD, of the foods to eat and the foods to avoid. But it is an educational process. But as young people, just stay away from tobacco.
I think also it's important to emphasize that leaders occur at all levels, and that you can be a leader even as a young person, because you're an influencer. You have your own circle of influence, and that's where you can really carry the message. The other point is also to emphasize that even during a pandemic, cancer goes on. It doesn't stop. And I will share with you very quickly, I myself just went through cancer surgery 3 weeks ago for skin cancer. So cancer doesn't stop. And so having leaders at every level, especially young people, they are the ones who can really create that change and amplify the change. And so I think it's important to remember that we are all leaders, and we all have our circle of influence where we can get the message out that cancer can be prevented, and we can do many things to reduce our risk for cancer.
Well, thank you, Doctor. And I know I speak for everybody by wishing you good health, and we also wish you a swift recovery. And of course, the mark of a good leader is that, you don't take everything on yourself, and you rely on the strength of your peer group, of your community. And that really comes down to Inefamalik and what we do as Guamanians. And we really draw upon the strength of our community. So former Speaker BJ Cruz and Dr. Annette David, thank you so much for your wisdom and your time and your leadership. Thank you very much.
Thank you.
Thank you.
Thank you so much, Jason. We're not done yet. We got many, many more virtual laps to go.
That's right. Stay tuned. Our virtual Relay for Life show continues after the break.
We missed everybody on May 15th, but I'm glad we're doing this virtually now. It gives us a chance to thank the survivors for their hard work in fighting cancer, the healthcare professionals, and the family and friends who provide love and support as our friends and family fight cancer. God bless everyone.
Support the fighters, admire the survivors, and honor the taken.
I relay for all the individuals that are fighting for their lives every day. This event is such a great opportunity to raise awareness and funds that go toward cancer research. It is also really fun to connect with such a great community of people and hearing about their different experiences. It's going to take all of us to make a change. I hope you'll show your love and support as well. Together, we can keep fighting cancer.
Together we unite.
Your support of Relay for Life makes these mission moments possible.